The threat of the coronavirus or COVID-19 disease is still present as more Filipinos on board the cruise ship in Japan are testing positive. How are health authorities dealing with this? We are joined in the studio now by World Health Organization Country Representative Dr. Rabindra Abeyasinghe. Good morning, Doctor, and thank you for joining us once again. So again, we have you. So much more information is needed for the people to know. So COVID-19 still present, still significant, and we have to watch out for this. Now, we understand plans are now in place for the evacuation of Filipinos from the Diamond Princess cruise ship. But more have now tested positive. There are observations that they should have been actually quarantined away from the ship when it was initially reported. Do you think this could have lessened the number of cases?
So the number of cases becoming positive on board the ship is sort of stabilizing now.
Right.
What is not known is that the number of positives among the cruise ship passengers is really steadily going down.
Okay.
And what we are seeing now is an increasing number of crew being infected. So what has happened on the Diamond Princess is the passengers were quarantined and the crew who were supporting them with their meals and stuff probably have been exposed, and they are the ones who are getting positive more lately. This is what we see from the data coming out of the ship. Now, we know that there are approximately 500 Filipinos aboard that. And if I remember correct, some 40 are tested positive yesterday.
Okay. Now, a follow-up to that question. Earlier, we saw a report on how a Japanese professor went on board the ship and observed certain things that were alarming to him, to say the least. Could you say something about that?
To my understanding, from what I understood from the Japanese authorities, this professor had not been cleared officially to go on board the ship. And I'm not quite sure how much he saw of the ship and what he was able to see. So his observations may not be really accurate on what was happening on the ship. Because if you're not formally going on board a ship which is being quarantined, you probably wouldn't be privy to the information of what is being done on the ship, right?
Right.
So you could end up with coming up with false conclusions.
Okay.
And clearly what we are seeing from the number of cases among the passengers significantly dropping on a daily basis, it's quite clear that the quarantine operations managed by the Japanese on board the ship have been very successful.
Okay. Now, some of those placed under quarantine, as you mentioned, are almost up. Their 14 days are almost up. What is the protocol after that? So once they have been released after their 14 days, what do they do? What do they do now? Are there further tests that they have to take?
Let me explain what we do with the 14-day, why we do a 14-day quarantine. So the best available information now points to an incubation phase of about 12 and a half days. So that's the time when somebody is exposed to the virus and the virus gets into him, the time required for somebody to become symptomatic.
Okay.
Right? If the 14 days is up, we assume that everybody who was exposed should have been symptomatic by now, or they have not been exposed. Of course, we need to reiterate that this is a new disease. We don't know everything.
Right.
We have to be careful. And from what I understand, many of the countries whose nationals are on board have advocated that when they come back, they still need to practice quarantine for 14 days, assuming that the last day of exposure was the last day on board the ship.
Okay, so we're doing the best with what we know now.
Yeah.
Now, is the second quarantine needed? Because a lot of people might say, okay, during those in the 14-day quarantine, what would happen if they got the virus on day 11 and they would be released?
So that's precisely why the US and some other countries whose nationals are on board saying you need to do self-quarantine for another 14
for another 2 weeks.
Yeah, just to make sure, right?
Now, so this goes with those who undergoing self-quarantine for a lot of those who have gone home, who have already done their 14-day quarantine, are advised to go under self-quarantine. should they still be consulting their doctors, or is a self-quarantine with themselves enough?
No, so the advice for people going for self-quarantine is to do twice daily monitoring of your temperature and to report the earliest respiratory symptoms that you get. And of course, to inform your doctor of your travel history. Say you've come from the Diamond Princess, or you've been to an area affected by the COVID-19 disease. That will prompt the clinicians to investigate and test you for the presence of the virus. So that's the idea.
Okay. So how about the ones where the Japanese have issued certificates for those that they're okay to travel and go wherever they want? Are the local people, like in Yokohama, at risk?
I don't think, because the Japanese believe that they've sort of done what is necessary, and they are confident of the quarantine measures that they implemented.
Okay.
So from their perspective, they have isolated the people in their respective cabins, and they could not be infected. So that's why they've given a certificate saying they're okay to be in Yokohama.
Right.
Right?
Okay. So 14 days is still the standard quarantine time that the WHO recommends and follows, because there are some reports, I'm pretty sure a lot of Filipinos have heard reports here and there about the virus having a 24-day incubation period. Is there any truth to this?
So that was based on one report of a publication which came out of Guangdong University. Again, it was a cohort of about 1,100 patients. But the breakdown of exactly how many people had that long incubation period was not provided. So it looks like they were outliers, very few. We don't know the breakdown of that information.
Right.
We are looking at that to understand that, but clearly in the vast majority of cases, the incubation phase is up to 12 and a half days, and the median of that is about 5 to 6 days. So most people will become symptomatic within the end of the week.
Okay. Now, doctor, with everything that's going on, is there any hope in sight? Does the WHO see signs that the virus is at least slowing down a little bit? Because we've heard some reports of some Filipinos have been cured from it or are recovering from it as well. Is this a good sign?
It is a good sign. Look at the numbers even coming out of China, right? For the first time, we are seeing that the cases are decreasing for the 15th day running now, steadily decreasing in numbers. We've passed the peak of cases that were reported in a single day. And so this is a good sign. And it clearly shows a very significant decline in all of the other areas outside of Hubei province. Even in Hubei province, we are seeing a gradual decline now.
Right.
So this is good. It shows that the control measures being implemented in China are bearing fruit.
Right. Now, you mentioned the Hubei province because the WHO actually sent a team to go to China. What were they able to gather? What kind of data were they able to gather?
So the team is working, it's a joint international team working with Chinese scientists.
Right.
And the idea of the team going there is to understand some of the work being done by the Chinese scientists and to better understand this virus and this disease. It's just a few days since they've started their mission.
Okay.
They haven't shared any information as yet.
Okay.
But we understand that they are working well with their Chinese counterparts. Okay. And we are hopeful that we will get some information.
Was part of the mission of the WHO to find the first person who contracted this, or actually patient zero?
No, that's not. That's not the mission. The mission is to understand the virus and how it can be controlled and how it spreads and what needs to be done to manage patients, right?
Okay, so thank you again for all that information. At least a lot more Filipinos are in some way relieved to get the latest information from you, Doctor.
If I may,
yes.
Freddie, I think we need to reinforce again that the main response to this challenge has to be practicing simple good hygiene, washing hands frequently, using social distancing if you're having respiratory signs and symptoms,
Okay.
sharing your travel history with your doctor, making sure that your food is properly cooked.
Yes. All right. Very well said, Doctor. And thank you for your time this morning. This is WHO Country Representative Dr. Rabindra Abeyasinghe.